I want to thank the senior senator from Maine for her long and arduous work as part of a small group of senators that really did try, I think, honestly and with great integrity, to try to advance this process so that we would have a bipartisan product to deal with. And I appreciate her efforts. I heard a little bit of her frustration as she spoke on the floor this evening, but I want to thank her for her leadership. And I would concur with my fellow senator here from Oklahoma. We all agree that reforms are needed in the healthcare world. We all agree that the status quo is not acceptable. But where we differ is certainly what leads us to the discussions this evening and tomorrow and up to the vote tomorrow evening at 8 o'clock. Mr. President, typically this time of year, going into Thanksgiving and then the holidays that follow in December, we consider this is the season of giving. This is where we give thanks and we do a lot of giving back. And unfortunately, what we're looking at this particular November with this particular bill, this kind of makes it a season of taking away your ability to choose the health insurance that you want, taking away nearly $500 billion by cutting from Medicare, a program that is already strapped, a program that provides so much for our seniors and disabled, but we recognize that program is seriously underfunded and looking to literally go off the cliff by the year 2017. And by taking more of your salary, by increasing the Medicare payroll tax for government intrusion into your health care decisions. This health care bill before the Senate now is a massive overreach by the federal government that will result in our government having more involvement in your family's health care decisions and greater government intervention, cutting into 16% of our economy. Now, before we get into the policy debate of the health care bill, I had asked one of the interns in my office to go down to the Dirksen post office. We'd gotten an inquiry from a constituent in Alaska wanting to know if we could send him a copy of the bill. Well, the bill, as you can see on some of the members' desks here, when weighed at the post office there in the Dirksen, it weighs in at 20 pounds, 5.5 ounces. This is probably close to the size of the turkey that my family and I are gonna purchase for Thanksgiving. It's gonna take about $45 to mail that priority mail to Alaska, so we've suggested that perhaps the internet is the better option here. But in this 2,000+ page bill, you'll find the government requiring that you comply with an individual mandate where the federal government is going to tell you that you've got to buy health insurance regardless of whether or not the premiums are affordable. And this goes back to the senator from Maine's concerns. So much of this is about the affordability. If we require individuals to purchase health care insurance, but we haven't done anything or enough to make it more affordable for them, all we're doing is setting them up for additional penalty. Failure to comply will result in a $750 penalty per person to a family. We also know in this bill, our government is going to be telling employers that they've got to comply with an employer mandate, which places onerous penalties on a large number of our small businesses. So these are businesses, any business that has over 50 or more employees. And I think it's important to recognize that the SBA, the Small Business Administration, defines a small business as one with 500 or fewer employees. But for purposes of the employer mandate, we're going to say that if you have over 50, you will be required to provide for that insurance. So let's use an example here. Say you've got a small business, you employ 51 employees, and just one of those employees receives a federal subsidy for health insurance. Under this Democratic health reform bill, The employer will be fined $750 for each of his 51 employees, not just the one employee who receives the subsidy, but for all of his employees. So if you're a small business owner in our state of Alaska, in Anchorage or Fairbanks or Juneau, who runs a restaurant or a small hotel, that employer needs to know that he could be subject to a total of over $38,000 in penalties if only one of his employees seeks a government subsidy. This penalty provision alone in the bill is estimated to raise $28 billion to pay for the Democratic health program. Now, the bill before us today also subjects Americans to health insurance that the federal government is going to define that this is what you have to have. What the drafters of this 2,000-plus page bill declare is an insurance plan with a 60% actuarial value. So, in other words, all the discussion about, well, if you like the health care plan that you have, you can keep it. Yes, in fact, you can if it meets the definitions that we are setting forth within this, and the requirement that it's 60% of actuarial value. So in Alaska, we've got over 88% of the health benefits that are provided to individuals and small businesses by the largest insurance company there operating in the state. This is Premier Blue Cross. We're told that 88% will not meet this 60% threshold requirement. So what does that mean? You've had your insurance plan through Premier, your employer's provided it, but if it doesn't meet this threshold requirement, what then happens, those small business employees will then not be in compliance with the provisions of the bill, and so you're going to see penalties assessed. Many of my constituents are going to see those penalties assessed. They may lose the insurance that they have, that they like, but the penalty will be a massive increase in health insurance premiums. So when we talk about the promises of health care reform and what we're going to make available to you, I think most people believe that with health care reform would come a reduction in premiums, or at least not incredible increases to premiums. In this bill, we raid the strapped Medicare program to pay for expanding the role of government in health care reform. We raid future payments to the Medicare program through increased payroll taxes. This, Mr. President, I think it's important to recognize is an unprecedented and I think a dangerous step that plays a shell game with Americans. We're going to increase your taxes through the Medicare payroll tax. But then we're going to divert that money to pay, not for keeping Medicare solvent, and I mentioned earlier the insolvency cliff out there. We're going to divert that money not to keep Medicare solvent, not to increase funds to Medicare, to increase patient access to doctors and nurses that so many of my constituents are suffering from in Alaska. But instead, we institute a new Medicare payroll tax that is used to pay for expanding the size of the federal government and creating yet another federally run health plan. Now, we recognize that the insolvency of Medicare is real. The Medicare Trustees Report from 2009 said that the Medicare is going to be insolvent by the year 2017. But the drafters of this bill don't write a reform bill to fix Medicare's solvency. Rather, they're using this as an opportunity to tax Medicare funds to pay for the creation of another Medicare-like system. This is truly the height of hypocrisy and working against what is right and what should be done for Medicare. Now, the inclusion of a 5% Medicare payroll tax increase is bad enough, but when one realizes that the tax is not indexed to inflation, one can only cringe at the financial pain that is ahead for America's middle class. Now, there may be many people out there saying, oh, you're just increasing the taxes on the rich, individuals earning $200,000 or more and couples earning $250,000 or more. But you need to put this in context and from the truth this can be, back in 1969, Congress enacted the alternative minimum tax, the AMT, to ensure that fewer than 200 individuals paid their fair share of taxes. But unfortunately, the AMT was not indexed to inflation, and today we've got nearly 30 million taxpayers who face the long hand of the AMT tax, with many of them who fall squarely in the middle of the middle class. Now, Congress has consistently taken action to protect the middle class from the AMT, but we do this, as we all know around here, on a year-by-year basis, and each year is costing even more than the previous year, with the number of people that face the tax growing with each new year. The most recent one-year patch cost $70 billion. A 10-year fix is estimated to cost a staggering $447 billion. I think, sadly, history has a habit of repeating itself, and Congress has demonstrated a consistent inability to learn from its mistakes. So my prediction is that if the Medicare payroll tax increase becomes law, Congress will once again need to spend large sums of money to protect the middle class from this onerous new tax. Now, let's delve into the Medicare and Medicaid and the restrictions on access to doctors and nurses under these government health programs. In my state of Alaska, in our most populated city, Anchorage, we have very few general care doctors who are willing to accept Medicare patients. We just had a study that was done not too recently, and the number that was given in that study was there are 13 providers, 13 doctors that are taking on new Medicare-eligible individuals. So in Alaska, you're about to hit the magic age of 65, going on Medicare. You've got Medicare as your primary insurance, whether you like it or not. And what you learn is that when you're on Medicare, you've got very few doctors that are willing to see you. 83% of the primary care doctors in Alaska's largest city will not see Medicare patients. And these individuals who, before they were 65, enjoyed unfettered access to care when they were on their private health insurance, whether they had it through the municipality of Anchorage or if you work for a private employer, you're now realizing the harsh realities of Medicare and that you're going to face some severe restrictions in access to a primary care doctor. And it's primarily, we're seeing it on a very accentuated basis in Alaska, but we're seeing it in many parts of rural America. It's almost unthinkable to me, but the number of constituents that have come up to me and have said, look, just get us out of the Medicare system. Let us go out to the private market and purchase health insurance just like we were able to do it before we were on Medicare. Because regardless of the contributions I've made, regardless of how much I have paid into the Medicare system, it doesn't mean anything to me if I don't have access to care. And they're saying, I know that I've worked all these years to pay in, but I want my old insurance back. And it's because what we have done is we have restricted their access to services, and it's something that they've never dealt with before. And this problem is not just in my state. According to GAO, we've got states like Colorado, Oregon, New Mexico, who are facing these major restrictions in access to primary care doctors. Senator Daschle, when he was doing his healthcare tour last year, he was in Dublin, Indiana, and he was talking to doctors about how to best reform our healthcare system. And the doctors there in Dublin told the senator that the Medicare reimbursement rates aren't keeping pace with the cost of a medical practice. So if we know that private insurance pays significantly more than government insurance, then access under a government plan will undoubtedly be reduced. We've seen this both in Medicare and the Medicaid programs. Under the Medicaid expansion program in this health care bill, we know that Medicaid is now going to include individuals up to 133% of poverty. And under the Democrats' health bill, the federal government pays all of the costs covering newly eligible enrollees through the year 2016. Well, this is good for the states. It'll allow Alaska, for example, to expand the roles of the Medicaid program and include more Alaskans on the state's Medicaid program. But CBO has said that in subsequent years, so after 2016, the share of the federal spending is going to vary somewhat from year to year, but ultimately would average about 90%. Well, if you're responsible for your state's budget and your state can no longer afford the Medicaid program in the year 2017, when the federal government drops that coverage to somewhere around 90%, I mean, if your state is a balanced budget state like Alaska is, and your state revenues are going down because of what's happening with tourism or bad fishing season or price of oil, what then do the states do to continue the Medicaid program? Well, it seems to me there's a couple options. They can either drop the expanded Medicaid population, or they could reduce reimbursement rates and place the Medicaid enrollees who once had decent coverage in Alaska in the same predicament as my Medicare constituents are currently in. There's a reason why both Democrat and Republican governors have said that this Medicaid expansion is the mother of all unfunded mandates. Mr. President, well, all these provisions that I've mentioned were certainly enough for me to decide not to support this health care bill. The most troubling aspect that we're seeing certainly played out in the news right now is the impact of government rationing, which will allow the government to deny access to health care services. This is something that Republicans have been speaking about all summer with regards to various health care bills. We've all seen throughout the news and a great deal of concern over the announcement from the United States Preventive Services Task Force, the announcement that it no longer recommends routine mammogram screening for women between the ages of 40 and 49. This task force's recommendation is really just kind of a look behind the curtain of what we can expect if the government runs your health care. Under this bill, we're going to provide one person, the appointed position of the U.S. Secretary of Health and Human Services. We're going to give her the ability to make a wide variety of determinations, both on the health exchanges as well as in the government-run plan. I'm very concerned about what we're finding from this task force and what it means for both men and women who suffer from this deadly disease. And I can tell you without a doubt what this has caused is great confusion out there. The task force came out with their recommendations, and then shortly thereafter, Secretary Sebelius comes out saying that women in their 40s should continue to get mammograms. The task force is saying that women shouldn't even conduct self-breast exams. So you've got constituents that don't know what they should or what they shouldn't be doing. And this is why we clearly need a hearing to better understand how this task force came to their conclusions. But the bigger picture here, and I think what we need to appreciate, is this ordeal that we've been dealing with this week is really a glimpse into the chaos of what we could see with a federally run health plan and a massive expansion of the federal government's role in your health care. And I want to just mention, because there have been multiple accounts in the media about, well, no, we're not intending that this task force recommendation, that it's going to change in any way what coverage might be available to women. But I know that some of my colleagues on the other side of the aisle have recognized, in fact, that these recommendations do hold great weight with the policymakers and the insurance companies. One of my colleagues from Maryland has indicated, she says that she plans to introduce an amendment that would address or limit the costs of breast cancer tests for women 40 and older. And she says, otherwise, insurance companies may use this new recommendation as yet another reason to deny women coverage for mammograms. And in fact, in the bill itself, there are at least 14 references to the U.S. Preventive Services Task Force, and in Section 4105 is a provision that would authorize the Secretary to modify benefits under Medicare if consistent with task force recommendations and deny payment for prevention services the task force recommends against. So this could be a situation, I think we should be very concerned about how with recommendations such as we're seeing coming out of the task force, they inadvertently or perhaps advertently will impact a woman's access to care. Mr. President, I know that I've probably gone over my time, and the senator from Oklahoma is waiting, but I'll close my comments by saying that we do need health care reform. But I will echo the remarks of the senator from Maine. We need to do it the right way. Setting an arbitrary timeline, saying that we've got to get it done by this holiday or that holiday, or moving down the calendar. We've got to take the time to do it right. We've got to bring down the premium costs so that everyone can have access to affordable health care. Imposing mandates on individuals or on employers, if we haven't done anything to provide for greater affordability, we haven't helped the situation. And unfortunately, this bill doesn't help us with the affordability piece. I'm focused, as many of my colleagues are, on an alternative, a step-by-step approach to reduce our health care costs, to allow businesses to buy across state lines, allow co-ops to be formed so that fishermen in my state or other coastal states or employees of a small business can pool together to purchase affordable, comprehensive coverage. And just as important is certainly the need to preserve the rights of patients to see the doctors of their choice. We must make sure that we're protecting Medicare coverage for our seniors. We've got to eliminate the discrimination based on pre-existing conditions, ensure that expansions of government health programs will not result in restrictions in access to care because of reduced reimbursements to doctors and hospitals. And while this bill does attempt to address several of these issues, for instance, the one about eliminating discrimination based on pre-existing conditions, it delays the implementations of some of the more worthwhile provisions until the year 2014. We've got bipartisan support on many of these pieces individually, so why would we not try to work on those areas where we do have agreement, we do have consensus, rather than waiting till 2014. Mr. President, I held a town hall meeting in Chugiak, Alaska last week, and it was a pretty tough night. We had winds that were howling off the mountains, and snow all over the place, and real slick and icy roads, and over 200 people decided to brave the weather to come out to speak out on the issue of health care reform and what is happening here in Washington, D.C. And I will tell you, the one thing that those constituents stood and repeated over and over was, don't pass health care reform that is going to raise our taxes, that is going to increase our premiums, and that will cut Medicare. And, Mr. President, we need to listen to these folks. We need to listen to the American people. We've got an opportunity to do it right. And there's a lot of good work that goes on by a lot of good people in this body and outside these chambers. But we are at a point now where, because of deadlines and artificial deadlines, we are forced to a process tomorrow evening where we're going to have a vote on a motion to proceed to cloture. And as my colleague from Oklahoma pointed out, it's a bit of a shell. We think we're going to this health care bill that's 2,000 some odd pages, but in fact, the vehicle that we will be using as the motion to proceed is not what this is. So I'm not going to suggest that it's bait and switch, but it could be bait and switch. But Mr. President, I do believe that our opportunity to share our concerns about what is contained in this legislation is now. We need to take the time to explain to our constituents the concerns that we have, the problems that we have, the unintended consequences that we believe are part and parcel of this legislation. And so I thank the presiding officer for the time this evening, and thank all my colleagues for their coordinated efforts to help provide a little bit of insight to the American people on what we are dealing with the proposed legislation from the Democratic leader. And with that, Mr. President, I yield the floor.
Senator from Oklahoma.